Hey everybody, I am Richie, and I would like to thank you for joining me for an episode 5 of PTDude's Ask a PT. As fall and winter sports are arriving upon us, I'd like to discuss an injury that is often talked about, especially in the football scene. Soccer, football, basketball, and skiing all have some of the highest rates of injury involving the anterior cruciate ligament, which is often referred to as the ACL. The goals of this video are to identify where the ACL is, what it does, how it's commonly injured, and what to expect after an ACL injury.
Location.
So, where is the ACL located? Well, it's right there. Oh, you probably can't see that. Let's switch to anatomy vision. There, that's better. It's right here. Alright, let's introduce you to the cast. This bone right here is the femur. It's the long bone that runs from your hip to your knee. This bone right here is the tibia, and it's the big bone in the lower leg from the knee to the foot. This bone bears most of the weight in the lower leg. This bone right here is the fibula, and it's the bone on the outside of your lower leg that runs from your knee to your ankle and forms the bump on the outside of your ankle. Now to the meat and potatoes of this video. These two ligaments are the cruciate ligaments. They are called that because they cross. This one right here is the posterior cruciate ligament, or the PCL. And this one right here is the anterior cruciate ligament, or the ACL. Now that you have an idea of the basic anatomy, let's move on and discuss the function of the ACL.
Function.
So, what does the ACL actually do? The ACL prevents anterior tibia translation or posterior femoral translation. What this means is that the ACL works to prevent the tibia, or the shin bone, from gliding in front of the femur, or the thigh bone, and vice versa. It also works to prevent you from straightening your knee too far, otherwise known as hyperextension. Another job of the ACL is to resist rotation in the knee.
How it's injured.
Would you be surprised if I told you that most ACL injuries are not from a direct contact? Yeah, that's correct. Research suggests that only 30% of ACL injuries are from a direct hit to the knee. 70% of ACL injuries are non-contact injuries. Some of these non-contact injuries include planting on your foot and turning, quickly decelerating, and cutting while running. Any of these can result in ACL sprains or tears.
Recovery.
If surgery is not recommended, most ACL injuries will recover within a few weeks to 3 months. In physical therapy, you can expect to have a program focused on restoring joint mobility, increasing strength and endurance in surrounding musculature, especially in the quadriceps, agility exercises, bracing, and activity modifications. If surgery is recommended, generally, recovery will take around 9 months. For returning to sports, you can expect a 12-month or longer recovery timeline. During recovery, physical therapy will be guided by a protocol, which is basically a guideline that sets you up for the optimal healing and progress within parameters that are safe for you. The goals of post-surgical management are to restore your knee motion, knee strength, ability to walk, balance, overall function, and ability to perform in sports. Thank you for watching my video. I hope you enjoyed it. Please hit the subscribe button so you don't miss out on future videos.